This is Marie's Message 411 TV, going live once again with my sister's keeper. Yes, another episode. Come on into the chat. It's Sunday. Yes, Sunday night. Everyone is getting ready for next week, for the work week. Yeah. So I have a topic for you tonight that can be triggering. So, I'm just warning you, put away the children. This is not for children. And for those who have been pregnant and have been in domestic violence relationships, this live might be a little triggering for you. So, I'm warning you. I have some information that I want to share with you. I have had personal experience with domestic violence and being pregnant. And I have a few videos that I want to share with you. So come on into the live. Come on into the live. Yes, this is Marie's Message 411 TV. Hello, hello. How are you doing this evening? How was your weekend? I had a productive weekend. I worked this weekend, but I did get some rest. Yes, yes. So come on into the live so that we can have a conversation. Sipping on my cocktail. I don't see anyone yet. Come on into the live. Hello, hello, hello. I don't know why I'm having this little shadow. I think it's my lights. Come on into the live. Come on into the live. Tonight we will be talking about domestic violence. Domestic violence. Domestic violence against women who are pregnant. And I must warn you, it can get a little graphic. Yes. I have a few videos I want to share with you. Let's see. There was research done at a college in Ohio. Prenatal exposure to domestic violence. The Center on Trauma and Adversity at Case Western Reserve University. And Case Western Reserve University is in Ohio. I want to read the research that they have done on this topic, and I want to share a few videos with you of individuals talking about their experience in a domestic violence situation and being pregnant. Who is that I see in the chat? My eyesight isn't that great, and the words are so small. But welcome, welcome, welcome. Hello to you. How are you doing this evening, this Sunday evening? Thank you for joining my live. Jack Joseph and Morton Mandel School of Applied Social Science, the Center on Trauma and Adversity. Prenatal exposure to domestic violence. The prevalence of prenatal exposure to domestic violence. Desi Richards, hello, how are you? Domestic violence, also known as intimate, intimate partner violence or IPV, is a serious public health issue worldwide that affects individuals of all ages, but is most prevalent among women of reproductive age. This human rights violation involves physical violence, sexual violence, stalking, and or psychological aggression committed by a current or former intimate partner and has significant adverse impact on health and well-being. As you come into the chat, please click the like button. Thank you. I appreciate you. Recent U.S. national prevalence estimates show that over one-third of women, which is 43.6 million, have experienced domestic violence at some point in their lifetime, with 21% exposed to physical violence, 18% to sexual violence, 10% to stalking, and 36% to psychological aggression. Between 3% and 6% of pregnant women in the United States experience a physical form of domestic violence. According to the U.S. Centers for Disease Control and Prevention's, the CDC, Pregnant Risk Assessment Monitoring System, clinical studies using more comprehensive domestic violence measures yield higher prevalence rates among pregnant women, indicating that between 11% and 28% of the U.S. women experience physical assault, 36% experience psychological or verbal abuse, and 20% experience sexual violence by a current or former intimate partner. The economic burden of domestic violence. Domestic violence imposes a substantial economic burden to society at large in the form of increased health care costs, increased crime costs, and reduced productivity. The average annual cost of domestic violence is over 5.8 billion in each year in 1995 US dollars, and the lifetime costs derived from childhood IPV exposure are estimated at nearly 50,500 per victim and over 55 billion in total cost in 2016. Please share the live so that others can come on into the live. Domestic violence and maternal health. Women who experience domestic violence during pregnancy are twice as likely to miss prenatal care appointments or initiate prenatal care later than recommended. Twice as likely not to initiate prenatal care until the third trimester, and are significantly more likely to miss 3 or more prenatal visits than non abused women. 13, poor nutrition. Poor nutrition, inadequate gestational weight gain, and high rates of smoking, alcohol use, and substance use have also been associated with experiencing domestic violence during pregnancy. These lights make me hot. Domestic violence during pregnancy and in the postpartum period has been associated with depression and post traumatic stress disorder. Okay, some of the reasons why women who are pregnant, who are in domestic violence situations, don't go to their prenatal visits is because they have bruises. They have signs that show that they have been abused. And it will show up if they go to their prenatal care and doctor visit. So a lot of times they don't go to the doctor visits. And that's one of the main reasons. Another reason, their partner who abused them left bruises, and the partner know that if their partner who is pregnant to see a doctor, they will see the bruises and then the state will probably intervene. So they stop their partner from going to get prenatal care. Hello, hello. Who do I see in the chat? JJ, JJY. Hi, how are you? Good Sunday evening to you. I hope all is well. Who else do I see in the chat? Is that Bossy or Rossi? I hope I'm pronouncing that right. Hello, how are you? Thanks for joining my live. Please like up the live as you come into the live. Thank you. Prenatal exposure to domestic violence and child outcomes. Low birth rate and preterm birth. Women who experience domestic violence during pregnancy have a high risk of preterm birth and delivering low birth weight neonates, meaning that the child is underweight at birth and has to be kept in the neonatal unit until the child fully develops. Low birth weight and preterm birth are leading causes of neonatal morbidity and mortality. Morbidity and mortality, meaning that the fetus, the child, did not survive. Per, parent, parental death, perine. It's hard to pronounce this word. Perinatal death. That's what I was trying to describe when I said the morbidity and mortality. Domestic violence occurring during pregnancy is associated with an increased risk of perinatal death. The the fetal loss after 20 weeks gestation up to neonatal health occurring 28 days after delivery, and neonatal deaths within the first month of life. These are the things that happen to the child and to the mother because of domestic violence. The extent of the domestic violence, the trauma that the unborn child suffers along with the mother. Women who have been hospitalized for a physical assault during their pregnancy are at a higher risk, 8 times the risk of fetal death and nearly 6 times the risk of neonatal death. Adaner, Adaner, are there any Turks? What is a Turk? Hello, how are you? Adaner. What is a Turk? I don't understand. Turks. What is a Turk? I'm talking about domestic violence towards women who are pregnant and the effects of the domestic violence on the fetus and the unborn child. That's what I'm discussing right now. Child behavioral health outcomes of prenatal exposure to intimate partner violence, infant post traumatic symptoms. Prenatal domestic violence exposure is associated with increased levels of trauma, symptoms being easily startled, repeating the same action without enjoyment, while considering accumulative risk and postnatal domestic violence exposure. Infant temperament. Infants with prenatal exposure to domestic violence are twice as likely as their non exposed counterparts to be considered as having a difficult rather than easy temperament, being withdrawn, slow to adapt, and generally negative mood. Childhood behavioral problems. Prenatal exposure to domestic violence is related to more externalized behaviors, physical aggression, disobeying rules, cheating, stealing, or destruction of property, and internalizing symptoms, anxiety, or depression during middle childhood compared with non exposed children. If the child continues to experience domestic violence exposure throughout his or her lifetime, the child continue to have increased externalized behavior problems and internalizing symptoms. Before I go forward, I have some videos that I want to share.
How are you feeling? Your baby is healthy and you haven't had any pregnancy complaints. I'm pretending that everything is fine, but I'm ashamed of the abuse in my relationship with my partner. If I actually had the time to sit and talk with my patients, I would ask more about that bruise I saw instead of taking your word for it. Well, domestic violence often increases during pregnancy because it's a vulnerable period in a woman's life. And even if you wanted to tell me what was really happening, you're too afraid because your partner is right in the waiting area.
He hit me before I had Javon. I didn't even know I was pregnant, to be honest.
Yeah.
And he hit me and he blackened my eye because I was trying to leave. And I was like, I don't want to be with you. I'm not going to deal with this. And he hit me and he blacked my eye. And I was like, I'm just through. I called the police and I had to go to the hospital just to make sure I didn't have like any brain injuries or anything like that. And then I found out I was pregnant. Right. And I was like, oh my goodness, what do I do?
Domestic violence is Man, I've had my own experience and it's not pretty.
Some narcissists reveal their true nature to you once you get pregnant with them because they know that now you can't escape. Now they have you chained. Now you depend on them. Now you feel vulnerable, and they are going to weaponize all of those things completely against you. Their cruelty crosses all the limits. The fights increase. They push you to starvation. They keep you in a constant state of hypervigilance, 24/7 anxiety and stress, on top of all the hormonal changes and alterations that are happening in your body, making everything 100 times worse. They show no compassion whatsoever. It seems like you are an incubator, and the only thing they want out of you is that child, and they just wait for that moment. Once they get it out of you, they discard you emotionally, even if you stay in the relationship. Your job is done.
Oh wow. This is not an easy subject to talk about, but it needs to be talked about because it happens very frequently and it's hidden behind closed doors and no one wants to address it. It's like the big elephant in the room. Everybody's afraid to address it. Part of the problem is that we don't we haven't learned conflict resolution. We have anger management issues, and the vulnerable is preyed on constantly. I feel that people who do this deserve to go to prison and just they need to be put under the prison. That's just my opinion. That's my opinion. That's just my opinion. Come on into the live. Come into the live. I still don't understand that question. Are there any Turks? You still haven't answered the question. What does that mean? Implement, implications of policy and practice, implication of trauma enforced care. Medical professionals have called for um, system level change to train physicians and nurse practitioners in the implication of domestic violence screening tools. So basically they're teaching the nurse practitioners how to recognize when a patient comes in to the for prenatal care and there is signs that they are being abused at home, right? There's certain questions that they ask, certain exams that they will do, certain observations to pick up on if you are being abused, because sometimes what a woman will do, she will lie. She will actually lie to them about her condition, because I don't understand how, even in our worst condition, being abused at home, we still protect our abuser. We still cover up for them. We still make excuses for them. Ref, they have domestic violence screening tools, and referral to community based subsequent care, counseling, mental health support, other health and social services. Such system wide change should include training in the application of trauma informed care with patient interactions to reduce potential re-victimization during screening and enhance the likelihood of prevent preventative care engagement. Sometimes when you go to a prenatal office, they will have pamphlets, and they will give you pamphlets and information on domestic violence against pregnant mothers. They will give you those pamphlets and hope that you read them, because in those pamphlets they have ways to help you to to get away from the situation that you are in. And there are centers and places that you can go, safe places that you can go, to be away from that and to protect yourself as the mother and to protect your unborn child. But some women will not read the pamphlets, will not take the advice. They are too afraid. They say they love the partner and they don't want their partner to get in trouble, and they go back home and continue to accept the abuse. That's so much for this information. Oh, you're trying to say thanks so much for this information. Oh, you're welcome. Who is this? Chris? Good evening, Chris. How are you? I can't pronounce all your name, but I see Chris. And I think you're trying to say thank you so much for this information. I appreciate you, and you're welcome. Continuity of community-based service to improve and restore domestic violence exposure, children's health and development intervention effectiveness for domestic violence could be improved by establishing continuity of services that extends beyond clinic settings for vulnerable mothers, including collaboration among services providers, linkages between justice and social systems, and long term follow up for advocacy and peer support. Community based interventions such as home visiting programs, nurse family partnerships, home based nurse visitation program for at risk mothers and their infants, and parent engagement models such as Triple P, Parent Child Engagement Program, to develop strategies for parenting, show positive effects on children exposed to domestic violence. The reason I'm reading all of this to you is because this is a research that was done by Case Western Reserve University in Ohio. And I was born in Jamaica, but I migrated to the United States, and I lived in Ohio for more than 30 years. And I have passed Case Western University campus many times and have been on the campus of Case Western Reserve University. So I'm reading the research that they have done concerning domestic violence and pregnant mothers, and the negative effects that it have on the fetus and on the unborn child, on the negative effects on the mother. And sometimes if the child does live through all of that trauma, the child has mental and psychological issues while growing up, especially if they are born into that toxic domestic violence environment and continue to live in it even after birth. Tyler, good evening. I love to talk to people and I am shy. Aw, welcome, Tyler. I appreciate you. Click the like button as you come into the live and please share the live. Prenatal preventive education for high risk mothers and fathers. Prenatal education about adverse developmental outcomes associated with prenatal domestic violence exposure should be implemented as primary prevention for high risk women, those with lower prenatal care visits and or prenatal substance issues or substance use. Fatherhood programs engaging all men and especially high risk groups, teenagers, men with histories of domestic violence perpetuation. So if the parent has a history of growing in domestic violence, then it's probably going to repeat itself once they get a woman pregnant and start their own family, is what this is saying. And teenagers who they are children themselves, and yet now they are a parent and they have no idea how to parent because they're still a child, because their brain hasn't fully developed, their frontal lobe hasn't fully developed until they turn 25 years old, but they're teenagers and they're parents now and they don't know how to handle that type of responsibility. So the domestic violence happens. And that is the end of this article. What I didn't see though, you have domestic violence of the father against the mother in the relationship. But there are some mothers who are pregnant or were pregnant and they were the aggressor in the relationship. They were the one that was abusive and did not care about their fetus. They were the ones that used drugs or alcohol, smoke. That's another form of abuse on the unborn child, to put a spin on it. But the majority of the time, it's the father of that child or your partner who causes the domestic violence against the mother who is pregnant. I experienced domestic violence when I was pregnant with my daughter. I experienced so much abuse that there were two children before my daughter by my daughter's father that is not alive. I suffered abuse my whole pregnancy. I experienced my daughter's father kicking down the bathroom door. I don't even remember what we were arguing about. And I was in fear for my life. And I ran into the bathroom and locked the door and got down to cover myself, to cover my belly, to protect myself. And my daughter's father kicked the bathroom door down off the hinges, came in the bathroom, punched me in my eye and in my nose. I was under so much stress with that pregnancy that I would pass out. I had to be put on bed rest I think the last 2 months of my pregnancy. Domestic violence. And we go around protecting these people. It wasn't until my daughter was 2 years old before I got the courage to take my children and leave and never go back. I waited till he was at work and I packed up all of my things, put it in storage, and went to my mother's house. My daughter is almost 25 years old. So this was over 25, 26 years ago. And I do not regret walking away. And I am thankful that my daughter is a healthy child and she grew up to be a healthy young lady despite all the trauma that I sustained with being with her father. Hello, Stacy Ann. Good evening. Good Sunday evening to you. Please like up the live and share so that others will know that I'm live. I know it's Sunday and I didn't give a long notice. I just decided to go live this Sunday evening. You guys are used to me going live on a Friday evening, and I give you a little bit of notice. Sometimes I go on SoFlo TV and actually let you guys know when I'm going live. But this time I just went ahead and did it. And um, yeah, so I'm here discussing domestic violence against pregnant women. Um, and I was talking about a personal experience that I had being pregnant. Um, it, not all of my pregnancies were negative. Um, I did experience a wonderful pregnancy with my first husband, but with my daughter's father, he was he was a monster. Um, yeah, you are used to letting it. Yes, I'm used to doing that, but I just decided to go live this time and just do it. I don't know. I just felt the vibe, so I just did it. But thank you for being here. Um, um, I um, I want to give some flowers to one of my sisters, Miss Goldie Robinson. Miss Goldie Robinson is one of my biggest supporters on this channel. And Miss Goldie Robinson told me she was kind of moving slow this week. And I want to send her some extra love, some extra strength, some extra energy. I'm sending it out into the universe to Miss Goldie Robinson because she is one of my biggest She interacts with my channel on a daily basis. And I want to give her her flowers tonight. So, yeah, I want to hear from you all. Um, have any of you ever had any experience with domestic violence in a relationship while you were pregnant, or was it your mother that was being violated in the relationship and you were born into it? Those are some of the questions that would be interesting to hear from some of you. Are you a child that was born into domestic violence and your mom experienced domestic violence when she was pregnant with you? Or were you pregnant and you yourself experienced domestic violence? Leave your comments. Let me know. Shout out to Miss Goldie Robinson. Yay, Miss Goldie Robinson. I'm sending some love. I'm sending some energy. I'm sending some strength. We have to lift each other up as sisters, you know? This is called My Sister's Keeper. That's what this is called, right? So if your sister's crown is tilting a little bit to the side, you just kind of help her straighten it a little bit. Give her a little extra love. Give her a little extra strength. Yeah, we need to do more of that. And a lot of times, um, we hide we hide from the world. Like when I was being abused, I would wear makeup to like hide the black eyes from my family so that they didn't know. Like, I didn't even tell my family what I was going through. And some of these abusive men, they are smart enough that what they will do is they will they will hurt you in places on your body. They will leave bruises on places on your body where when you put clothes on, people don't see it. Um what Stacey Ann said, I have never experienced domestic violence. Well, that's great. That's great, sis. You're one of the few, because the article I just read before you actually came on the live, it was over 53 billion women in this country that have been abused, domestic violence, being pregnant. Marie, I am sorry that you were not able to. ah, you know, there's lots of reasons why women hide their abuse and they don't tell their family. Number one, you have a narcissistic partner who plays the part in the family as the charmer, the helper. They help your mom, they help your sister. Whenever we have get-togethers, they are the life of the party. Everyone loves them. They portray themselves to be such wonderful, like they put on such wonderful characters in front of family and friends and other people. But as soon as you get in the car or as soon as you get home, it's like Dr. Jekyll and Mr. Hyde becomes somebody totally different, completely different. My first husband was so abusive that the state had to pay for my divorce, and he was a deacon at the church. And he would go to church and everybody loved Deacon so and so. But as soon as we got home, he was a totally different man. And the abuse got so bad that the police had to come and get him. and lock him up, and refuse from the courts refused to let him see the children for a while. And all my bruises was in areas where I had clothes on where you couldn't see. I couldn't tell the pastor and the church and everybody that my husband was abusing me because he was the deacon of the church. He had the keys to the church. Everybody looked up to him. He was in the choir. It was like, it wasn't until the police got involved and the courts got involved that the pastor requested that he write a letter of apology to me in front of the church, or he would have to step down. And he refused to write an apology. And the pastor took the keys of the church away from him. And after that day, he never went back to church. And that was over some 30 something years ago. That was over some 30, yeah, some 30 something years ago. But yeah, we we feel embarrassed to tell anybody because they portray themselves in such a way to everybody else. There are times when financially we don't have the means to financially support ourselves, so we stay with the man and deal with the abuse because he's paying the bills, and we have no income and we're pregnant and we can't get a job. So I decided that after my daughter was born, before I came home from the hospital, I asked those doctors to cut my tubes and burn them, so that when I went back home, I could not have not one more child for this man. I had a plan when I gave birth to my daughter, and I said, if my daughter is a healthy child, I'm planning my exit. And my first exit plan was to make sure that I could never get pregnant again, at least not by that man, because I was still going home to him with my baby. And when my daughter turned 6 months old, I went to cosmetology school to get a cosmetology license so that I could start making some money for myself. And I started stacking my money. And yes, the father discouraged me from going to cosmetology school. He made it difficult for me to go to cosmetology school because he knew if I start going to school and I start making money, I will be no longer under his control. Yeah, what a deacon. That's one of the reasons why I started going to church, because that same deacon that abused me slept with my sister's best friend in our house, where our children were, in my marital house. Yeah, I've been through a lot. So I'm actually talking about two different situations in my life, two different instances, two different baby daddies in my life that I experienced abuse. And my daughter's father, I realized that, okay, once I get this cosmetology license, when I was in cosmetology school, I met my friend who is now a sister to me, and she was the one that convinced me to leave my daughter's father. And I met her when I got to cosmetology school when my daughter was 6 months old, and she helped me plan how to leave him. And by the time my daughter was 2 years old, I had finished cosmetology school. My friend had finished cosmetology school. She bought a salon, and I started working in my friend's salon, and I left my daughter's father when I was 2 years old. That's how I got away from him. I stopped being intimate with him. And he decided that if I'm not giving it up, me and my children can't live under his roof in his house. And once I left, he refused to pay child support. So the state went after him and told him, if you don't pay child support, you will be deported back to Jamaica. And that's how I got child support from my daughter's father. Because in his mind, if you're not giving me no cookie, then I'm not supporting you. And he thought he was spiting me by not paying child support for his daughter. Demons. I've been surrounded and been followed by demons most of my life. And these have been sexual demons. For the past couple years, I've been living a single life. And I have not been in any serious relationship with anyone. And I'm okay with that. I date, but I don't get in nothing serious with anyone right now. The person I was dating, he's gone to Thailand. He left for Thailand on my birthday. Yeah, I haven't been doing my live for a while now, for a couple weeks now, because I went to Philadelphia to celebrate my granddaughter's first birthday, and I came back because my granddaughter's birthday is a week before my birthday. And I came back and I celebrated my birthday, and my BFF, my best friend's sister, she took me out to one of my favorite food restaurants and I enjoyed that. However, my partner, date, relationship person left for Thailand on my birthday. This was something he had been planning years before him and I got together. So I knew it was to happen. I just didn't expect it to happen around my birthday. And he didn't say goodbye because he does not like goodbyes. So, yeah, I'm dating, I'm single. I'm enjoying getting to know who I am. I'm loving me. I'm exploring me. I'm building my self-esteem, esteem for yourself. That that's what I'm working on. These are the things I should have been doing before I made the decision to get into relationships that ended up toxic. I cannot 100% blame the partners that I had for the domestic violence that I experienced, because I also participated in deciding to be in a relationship with them. And even when I saw the red flags, I ignored the red flags because I thought I was Barber the Builder and I could change a man. I thought all of my love and kindness and care and empathy would change a man. And I'm learning now, if you can't change the man, change the man, if you know what I mean. It works. It's been working for me. I don't waste time no more. I don't waste time to find out about any type of abuse. It's been so long since I have experienced any type of abuse, domestic violence, any of that. It's been so long that if I experience it right now, it would be strange to me. Like I'm not used to that anymore. Like I've become a whole different person to the point where I look back and I think to myself, I actually used to tolerate that. I put up with that. I accepted that. I protected a demon like that. I put my child in danger like that by dealing with a person like that. But when you're not awakened, when you're not aware, when you're naive, when you're young, when you're gullible, when you're vulnerable, that's when these demons present themselves in your life. And because your vibrational level is so weak, so low, you're so depressed, you have low self-esteem, that's how they're able to creep into your life and just wreak havoc and cause chaos because you're young, you're dumb. Your parents didn't teach you. Your parents couldn't protect you because your parents allowed you to be abused when you were at home. And you leave home and go out into the world, and the abuse continued by other people because you don't know how to choose the right partner. You have not been taught. All you know is abuse from your mother, abuse from your father, abuse from this man and that man that come in and out of your mama's house. So of course I made bad choices in the partners that I chose. And let's get it straight. The first man I ever lived with when I left my mother's house was 10 years older than me, and my mother gave him to me. That deacon that I told y'all about that would go to church and read scripture and sing on the choir and then come home and be abusive to me? Yes, that one. My mother gave him to me. I didn't go looking for him and chose him on my own. My life is a novel, a true story novel. Like you could make a movie, a 2 3 hour movie just off of a small portion of my life. And when I tell people these things that have happened to me, they think I'm making it up. No, these things happened to me. Of course they were over 25, 30, 37, 40 years ago. But these things happen to me. So when I bring certain subject to you, I'm bringing it to you most of the time because it's something I have experienced in my own lifetime. And no, I'm not ashamed to talk about it. And no, I am not damaged because these things happen to me. And yes, I have gotten therapy. And yes, I am healing. And yes, I am not the same person I was 25 years ago. Heck, I'm not the same person I was 6 years ago. I'm constantly evolving and elevating. I'm constantly learning. I'm constantly taking accountability once I understand what happened when I was younger, the choices I made, the mistakes I made. I can now look back and see where I made a mistake. I can look back and see where the adults that was in my life failed me because they didn't know any better or they didn't choose to do any better. I can go back in my mind and take accountability for my heart, my stupidity, my ignorance, my lack of knowledge, my carelessness. You see, when you can do that, you can forgive yourself and you don't need any closure from anyone else to move on. That's true healing. I don't need a whole bunch of pills from a psychiatrist to heal. That's a part of it. Yeah, we were victims of domestic violence. Yes, it traumatized your unborn child. And in some cases, those children didn't make it to this universe. But we cannot stay in that place and blame ourselves. It happened. You can't undo what has been done. All you can do is learn the lessons in the mistake and move forward. Forgive yourself and move forward and make sure not to make those mistakes again because that was a learning lesson for you, for me. And the casualty of that lesson is that unborn child. I talk about it all the time, Stacy. Stacy Ann, it's many years ago. It was very emotional to talk about it without crying, without getting a lump in my throat, without losing my breath and feeling like I couldn't breathe, like I was suffocating. Those were the days when I couldn't talk about it because I would begin to talk and I would start to feel like I'm suffocating, like someone is like an elephant is standing on my chest. And then I would have repeated nightmares, the same nightmare every night. Shoot, not every night. Every time I closed my eyes to go to sleep, I would have the same nightmare for years and years and years. A big part of this is changing your thinking, your thought process. I often talk about something called stinking thinking. If your mind is clouded with that stinking thinking, with that woe is me, blame me, everything is my fault, that negative stinking thinking. You see, that's what the abuser does. Messes with your psyche, And while they're abusing you, they make you feel like it's your fault that you're getting abused. And then they go and buy you roses or buy you something you really like, a nice purse, a Birkin or something. Say they're making up to you. They want makeup sex. After they do all that abuse to you, they still actually want you to be sexually active with them. These sick demons, these sick narcissistic demons that permeate our atmosphere and go around preying on vulnerable women. Ha! Yes, I took back my power a long time ago, Stacy. I took that power back a long time ago. Sometimes when I talk about these things, I'm like, man, was that really me that experienced all of that? But there was a time in my life I never thought I would be in this mindset at this moment. There was a time in my life where I just didn't think I could go on, didn't think I could take another breath. I don't wish anyone to feel sorry for me. I don't wish for anyone to treat me like you have to walk on eggshells around me or you're afraid to say certain things around me. I won't break. If you go back and watch my video that SoFlo had on his live about what happened to me in my mother's house, what my brother did to me, if you go back and watch that live, the title of that live is Wounded but Not Broken. Wounded but not broken. And that's where I'm going to leave it tonight. And I'm going to say goodnight. I hope everyone have an awesome week. Tomorrow is Monday. It starts the work week. I know that everyone has to get ready to go to bed. They have to go to work. Kids have to go to day camp or daycare. Yeah. So, with that being said, thank you all for to the live, for engaging with me on this subject. Um, Share the live. Leave your comments in the comment section. This is Marie's Message 411 TV, and I'm bringing you another episode of My Sister's Keeper. Take care of yourself. Be good to yourself and be good to others. Respect others if you want to be respected. I'm not where I want to be, but I'm not where I used to be. Until next time, bye bye.